Let's even snap and post on Facebook. It's not funny. Maybe now one person vote for this.
Meet them now, the person.
Yeah. Let's go person.
Very knowledgeable. Ajuka nke dona nke tutu Canada ya. So they come or less exercise
This is Canada movement. Let Julius go to this Canada. Let everybody rest.
Ìfònúláàní Canada ò fáwọn àwọn ọba Nàìjíríà sípò nígbà yóò jẹ níjẹ nígbà ìgbẹ́jẹ sí ẹ̀yìn tó gbé ka ọ̀pọ̀ láì ìwé ẹ̀hẹ́ gbé jẹ́ kí òwe mọ àmọ́. Ẹ jẹ́ ọfà. Èsì kò gbà lọ lóòrùn ọ̀nà lórí ìbẹ̀rù. Ìpele ìgbà léyìí. Tí kò kó owó ọ̀yà nọ ìyẹ̀máwẹ̀tì. Right? What I you like go if you go view. No, this is when I look empty and get to the end of the time. Go
Next time she was.
Nice.
Nice.
Then I did not know the accent.
A very small girl. As you see how she tears small, very small girl.
I don't know.
Morning.
Told me she married at 27 here. The next thing now, let's say she should be.
Good morning, Doc. Ogarafu. Yeah. Good morning, Dr. Andy Shimaka.
Morning.
Yeah. How are you and the family, sir?
We thank God, and you.
Fine, thank God too.
We have 29 persons, 30 persons in the class already. Should we continue or should we wait for others?
I think 31 now. I think it's a good number.
Okay. Well, good morning, everyone.
Good morning, sir.
You would lucid. Remember to mute your mic. To practice.
Sorry. I muted the mic. I checked it.
You know, sometimes you unmute, so you have to be checking often. Nathaniel Asogo.
Yes, sir. Good morning, sir.
I was just trying to remind you to off your.
Good morning, sir.
Oh, wow. Hello. Good morning.
Good morning,
Yeah, good
sir.
morning, Doc.
Hope we all
Small. Okay, my thoughts.
we all
I
slept
can
well.
barely hear you.
Look at your man. Okay, hello, good morning.
Yeah, good
I
morning.
think we have enough persons in the class to start now.
Yeah, we did. But
I'm working on it. Okay, can we have a recap of what we did yesterday?
I said Joseph.
No,
I look to go about.
Hello,
hi.
Sir.
can we
Yes,
have a recap
sir.
of what we did yesterday?
With you. Good morning, sir.
Good morning.
Yes, sir.
Can you
Okay.
please add the volume? We are barely hearing you.
Let
You are ready?
sir.
Okay.
Okay. Good morning, sir.
Good morning.
Yes. So one of the things my name is Tioko Sofanya. So one of the things we discussed yesterday was the different types of disorders, psychotic and neurotic disorders. And then you said the term psychotic disorders refers to the different categories of mental health conditions, primarily distinguished by the severity of symptoms and the individual's grip on reality. So you said neurotic disorders involve distress and emotional instability, but the person generally remains in touch with reality. The person doesn't hallucinate, there is no delusions. The person only has a high level of anxiety, worry, or mood swings or something like that. And then you said one of the examples of neurotic disorders is phobia and general anxiety.
Phobia.
Yes, sir. Phobia and then generalized anxiety disorders.
It's okay.
Then you also, okay, sir.
Now go
Should I
ahead.
continue? Okay.
You
So
can
you also
conclude.
talk about psychotic disorders, and then you say it involves a loss of contact with reality. The person is characterized by hallucination and delusion and disorganized thinking. And then we spoke about we discussed schizophrenia.
That's great. Any other person? Thank you for that recap, Tiokosu. Do we have any other person?
Good morning. Yes, sir.
Good
We also
morning.
talked about good morning, sir. We talked about schizophrenic disorder yesterday, which is the combination with the good that lead to complex and verified presentations. And we talked about one disease and the delusion disease.
It's okay. That's okay. Okay, so a way of summary, yesterday we had looked at the classification of psychopathology. And in our discussion, we classified psychopathology into two: psychotic and neurotic disorders. We have said that neurotic disorders are disorders that do not affect an individual to an extent of losing touch with reality. And we had examples like generalized anxiety disorder, phobias. We spoke of psychotic disorders. There we spoke about schizophrenia, spoke about bipolar 1 disorder. We had also looked at, very briefly, at the treatment of the causes and treatment of psychotic disorders. And we had agreed that there are basically 3 to 4 causes. And these causes were looked at under what we call the biopsychosocial model, bringing in an interplay of biological causes, psychological causes, social causes, and of course, we had the 4th one, the Nigerian factor. We're looking at this as triggers or causes to the onset of psychotic disorders. We also highlighted treatment approaches that were pharmacological in nature and were also psychological in nature. We also took a look at personality disorders. We say that a deviation from the normal individual personality shows that an individual has a personality disorder. We considered the definition of Gordon Allport, and we were trying to express or explain some variables in that definition, because he said it is the organization of an individual's dynamic and persuasive traits. And we're saying that our personalities is organized within the psychophysical system of an individual. The physical system manifests or brings forth what happens in the psychological system. And we say that behavior is made manifest. And we say that when there is a deviation from the normal personality output, it becomes a disorder. And yesterday, very briefly, we were able to look at the grouping of personality disorders according to their characteristics. And we had grouped personality disorders into 3 categories or clusters, as we had looked at. We looked at cluster A, that had to do with behaviors, eclectic behaviors. And we said there we had what we call the paranoid personality disorder, which main characteristics or symptom is paranoia, which has to do with suspicion of people around you, willing to harm you, and delusions of grandiosity. We look at the schizoid and schizotyper as personality disorders that are first under cluster A. And under cluster B, we had looked at histrionic borderline personality disorder. We looked at narcissistic personality disorder. And I think we stopped yesterday looking at the narcissistic personality disorder. That's where we stopped yesterday. And we say that those who are narcissistic or those who suffer from this disorder have unstable emotions. They have a distorted self-image. For histrionic and for narcissistic, we say they have a perceived persistent pattern of superiority in any group where they find themselves. And they also suffer grandiosity, feeling of superiority over others within the group, and not minding whether the self-esteem or whether other persons within the group or within the society, are hurt. They don't care about, they don't empathize with them, they don't have empathy for one another. And they also, these behaviors are as a result of their low self-esteem, trying to build up trying to come out of their low self-esteem by intimidating others and, trying to be on top. Today, we will very quickly look at the cluster C personality disorders. These disorders are characterized by severe anxiety and excessive fear. I would say the first one is the avoidant personality disorder. We had looked at cluster C, but I want us to go over it again because at this time, everybody got tired and the participation was actually low. So we have said again, as a form of refreshing, that avoidant personality disorder, people who suffer this personality disorder have chronic feelings of inadequacy. They're always feeling they're not important. They are highly sensitive to being negatively judged by others for everything they do. They feel others will criticize, we look at the wrong side of it or where they have failed. Even though they will desire to have interaction with other social networks, but they tend to limit this social interaction due to the fear that they might be rejected by this group. And we also look at dependent personality disorder. People who suffer this type of personality disorder, they have excessive need to be cared for. In a group, others prefer that they should be cared for. It is not it's not normal when you are in a group and all you depend for is that you should be cared by others. You went out for an outing, you have your resources, but you're waiting for others to buy food for you. You're waiting for others to buy drinks for you. You are waiting for others to pay transport for you. You are waiting for others to do everything you want to do for you. You become so dependent on others. It is a disorder. It is not normal. It is actually not normal. And this is a personality disorder, and it is that dependent personality disorder. And, these kind of people are so submissive, irrespective of their age and their attainments in society. They are so submissive because they need a constant reassurance, or they need constantly to be cared for by someone else. They need there is need for a constant reassurance of the inability to make decisions. So this type of persons that fall under this category, they are waiting for others to take decisions for them to follow. They are looking for someone to point hands at, yes, I did this because he directed me to do, he suggested that this is the right way to go. So people with this the personality disorder often become so close to one another and spend a great effort or great deal of their time trying to please other persons. They tend to display passive behavior. They're not active. They are passive in decision making. They are passive in activities. They are passive in spending. They are passive in everything they do because they are afraid that if they are active, the end result may be separation. They may be separated from their source of dependency. So this is the characteristic traits of dependent people who suffer from dependent personality disorders. You will also begin to notice this kind of people within your society, within your office, within your church settings, within your social networks. You will notice that when you see them, people depending and presenting some of these traits, you know that these people suffer from personality disorder, and their correct diagnosis is dependent personality disorder. Are we together? Are we together?
Yes, sir. You are married.
Yes, sir. We are together, sir.
We are together.
Okay. So another personality disorder under cluster C is the obsessive compulsive personality disorder. This type of personality is characterized by consistent and extreme need for orderliness and perfection. People who suffer this personality disorder are striving for perfection. They are so orderly and they so controlled, they don't give room for flexibility. Now, for this type of people, when you get, let's take for example, when you get to their rooms, the chairs are well arranged. The room is kept. That once they get in, they are seeing one or two things to dust, to clean up. You know, their desire for perfection is on the extreme. Now, their beds are made so straight. When you sit on their bed, they expect that the bed should not squeeze. You should be able to fix it back. It should be straight. These kind of people don't give room for flexibility. They don't give room, but they don't have the understanding that not everybody, you know, it's in the same category with them. They want perfection all around them. Now, these characteristics often slows or interferes with the ability to complete a task within a given period of time. And it also interferes with their relationships. We're told the story of a person who suffered from obsessive compulsive personality disorder, who had to send his wife packing because the woman could not hold the toothpaste and press the toothpaste the way he expects it to be done. This kind of people expect that if it's a toothpaste, you should start using this toothpaste by applying pressure from the end gradually. Now, when you mistakenly hold the toothpaste in the middle, there is a problem because there is no room for flexibility. They want everything they do to be perfect. You know, when you want to be a perfect human being, you know, you are at the extreme end of your personality, and it's called obsessive compulsive personality disorder. These behaviors are repeated. That does not mean that we must strive for perfection, but when there is a consistency in ensuring that things must be the way you want, the perfect way you want them, it is actually also abnormal, and it is called obsessive compulsive personality disorder. This personality disorder is a separate condition from it's a separate condition from obsessive compulsive compulsion. You know, obsessive compulsive disorder is different from obsessive compulsive personality disorder. While we're looking at our classification of psychotic, of psychopathology or psychosis, we were saying that neurotic disorders also is the umbrella name that has under it obsessive compulsive disorder. It is also one form of an anxiety disorder. So obsessive compulsive personality disorder differs from obsessive compulsive disorder. OCD is an anxiety disorder, while obsessive compulsive personality disorder is characterized by consistent and extreme need for orderliness. Now, in obsession, there is a repetition of a particular behavior. Usually, the individual is aware that his obsession and compulsion is causing his behavior, you know, but he does not accept the need to change. He does not accept the need to change. So you see repetitive behavior like washing of hands, you know, you see repetitive behavior like cleaning a particular area or cleaning the face, a feeling that my face is it's either oily or it's dirty. You know, this is an anxiety disorder and not a personality disorder. So there is a difference between obsessive compulsive disorder and obsessive compulsive personality. Are we together?
Yes, sir.
Yes, sir. Yes,
Is that understood?
Yes, sir.
yes, sir.
So when is the onset and who are the category of persons that are affected by personality disorders? First, I want to say that anyone can have a personality disorder, but different types of personality disorders affect different people at different times. Mostly, personality disorders begin in the teen years of an individual. It begins in the teen years of the individual. That's when the individual begins to experience personality disorders. Now, as the individual progresses, the personality also further develops and matures. As a result of this, most people who are diagnosed with personality disorders are above, most people who are diagnosed with personality disorders, they are above the ages most of these people are actually above the age of 18. One exception is that for these people, they suffer antisocial personality disorder. Between the teens, 13, 14, 15, 16, 17, 18, 19. It's a period that houses the adolescent. Are we together? Hello?
Hi, sir.
Yes.
We are together.
Hi,
We
well,
are together, sir.
The teens houses a group of people called adolescents. And by way of definition, the adolescent period is defined as a period of no man's land. The adults don't own that period. The children don't own that period. So it is no man's land. It's a transient period from childhood into adulthood. Now, what happens at this stage is that the children rejects the adolescent that they are above their age, they are adults. Because they have cracked voices, they have started growing beards, they have started having nocturnal emissions. They feel they are adults. And adults remind them that they are not adults, they are children. And as such, they should go back and meet the children. So they'll be rejected by both the adults and the children, and they find a common ground. And that point is called adolescent. Now, why is it that there is a prevalence rate of antisocial personality disorder at this stage? Remember, we say that antisocial personality disorders have to do with people who break the law. Are we together? Now, it is because in that stage, they have their own culture. They have their own culture. We have the adolescent youth culture. It is a period of experimentation. It is a period where they have their own music. They have their own types of clothes to wear. They have their own network that differs significantly from the adult expectations. So, approximately, we say over 80% of people with this disorder will start having to show symptoms by the age of 11. Now, at the age of the 11, the young man or the young girl is trying to have an identity, a realistic self-identity. And the questions asked is, who am I? Am I a child? Am I an adult? Who am I? Are we together?
Yes, sir. We're
Yes,
together.
sir.
Okay. You are followed to this point, right?
Yes,
sir.
we are with you.
Okay. So antisocial personality disorders are more likely to affect males, while borderline, histrionic, and dependent personality disorders are more likely to affect the female folk. So the males, why the males? They want to experiment. They want to experiment everything they see. So there is a high tendency for them to break laws and rules and regulations that are set. And the female folk are more of dependent. They are more of looking for their self-esteem. They are neither, at times they are neither here nor they are not there. And that's why you see the population of those affected in borderline histrionic and dependent personality disorders are the female folk. Is there any question?
Not yet, sir.
What causes personality disorder? Personality disorders are among the least understood mental health conditions. Scientists are still trying to figure out exactly what causes individuals' personality disorders. So far, there are some factors that have been believed to cause an individual develop personality disorders. Scientists are identifying malfunctioning genes that may be a factor in obsessive compulsive disorders. They are still also exploring the role of genetics in human aggression, anxiety, and fear, which are traits that can play a role in our personality disorders. While considering types of personality disorders, we saw that people with narcissistic personality disorders express some level of aggression. And you will also notice that people with dependent personality disorders have a high degree of fear and anxiety. Fear to lose the source of dependence. So researchers are working to identify genes that are linked to certain traits that are, or certain variables that are under discourse while assessing and diagnosing individuals with personality disorders. Also, efforts are being made by researchers to identify subtle brain differences in people with certain personality disorders. For instance, paranoid personality disorder points to an altered amygdala functioning. The amygdala is the part of your brain that is involved with the processing of fearful and threatening stimuli. So you will notice that people with paranoid disorders are afraid, they have paranoia, they have fear of being attacked by close relations or close associates. So altered amygdala functioning is being linked, to people who have suffered or who have come down with paranoid personality disorder. And also, studies have shown that schizotypal personality disorders, volumetric decrease in the frontal lobe of the brain is linked to people who develop schizotypal personality disorders. So if we go back again very quickly to look at cluster A, where we had discussed schizotypal personality disorder, you will see that it is a condition that is marked with consistent pattern of intense discomfort with limited need for close relationship, because these people hold onto beliefs. Are we together?
We are together, sir.
Yes, we are.
Is that understood?
Yes, sir.
Yes, sir.
Okay. So beyond brain damage, we also have childhood trauma. Yesterday, we had discussed childhood trauma while we were looking at causes of when we're looking at causes of psychosis and neurosis. Studies have also linked childhood traumas and the development of personality disorders. Now, if you take a very close look at our relationship at home, a child who is not living with his or her biological parents, but is living with a parent who has traumatized him, you will notice that that child is going to develop, is going to have low self-worth, low self-value, low self-esteem. Probably when caregivers or when foster parents make comments such as, "You will amount to nothing. you will be a wayward child. You know, they tend to affect the child's capacity to accept, you know, his self-worth and also develop self-value for himself and his skills. So when efforts of such a child are not praised, you know, it tends to demean him and tend to help him build a negative personality of himself, or have a negative self-view of himself and his capabilities. So you will notice that children who are also abused, who are abused sexually, also, you know, develop personality disorders. So we're saying that people with borderline personality disorders and antisocial personality disorders have issues with intimacy and trust, because both have a history in the course of assessment of childhood abuse and childhood trauma. This, in the long run, affects the child's personality as he progresses into adulthood. Now, when you look at the Erikson psychosocial theory of personality development, you will come to agree that this type of children who are abused sexually or who are traumatized at an early stage, you know, when they come to the conflict theory, the Erikson conflict theory of personality, where we have integrity versus despair, you will notice that these children will have a despair and they will have a negative self-image, not just about families, but also about society generally. So instead of them to make positive contributions to the development of the society, they are somewhere antagonizing every form of development of the society. It is because they had an experience of childhood trauma that has built up cumulatively to help them have a negative personality about the society where they live in. And childhood trauma can also come in form of verbal abuse. Yes, children who experience verbal abuse are 3 times more likely to have borderline, narcissistic, and obsessive personality disorder, as well as paranoid personality disorders in adulthood. Now, most of these personality disorders for this kind of children, you know, build in gradually, and it's made manifest as they get into adulthood. You know, adulthood, because they are already at the position of taking decisions for others. And you will notice the type of decisions they take. You notice the type of leadership they provide. It is stemming from the experience that they don't have a positive and good view of what the society should be or is because of their childhood experiences. Are we together?
Yes, sir, we are together.
Yes, sir. Yes, Doc.
Have we understood to this point?
Yes, we do.
Yes, sir.
Okay. So also, cultural factors are linked to the onset of personality disorders. Now, this varies from country to country. For example, there are remarkably low cases of antisocial personality disorders in Taiwan, in China, and in Japan. But along with significantly higher rates of cluster C personality disorders. And you know, in cluster C, we are having personality disorders like dependent personality disorders. Why is it that people in these Asian countries have low cases of antisocial personality disorders? You also know the societal settings in these Asian countries. Now, you will notice that it is easier for someone to commit suicide for being accused of corruption. Are we together? In Nigeria, you also notice a high level of antisocial personality, high rates of antisocial personality disorder, because the laws of the lands are there, you know, to fulfill all righteousness. Are we together?
Yes, sir. We're together.
Yes, sir. We're together.
So each of these 10 personality disorders have its own specific signs and symptoms. We have looked at the causes of personality disorder. We have looked at the role of genetics, which is ongoing. Research is ongoing to find possible links of our own characteristics to the onset and development of personality disorder. We have looked at the role of brain changes. We spoke about amygdala functioning, how it influences the development of a schizotypal personality disorder, and also paranoid personality disorder, as we have mentioned, volumetric decrease in the frontal lobe. We have looked at childhood trauma, we have looked at verbal abuse, and we also look at cultural factors as contributing factors to the development of personality disorder. I want us to very quickly look at symptoms. What should I be looking at in a person to qualify him to be diagnosed to be suffering one type of personality disorder or another? And the first thing you are going to look out for is identity and a sense of self. You know, people who suffer personality disorder generally lack a clear or stable image of themselves. The big question they keep asking is, who am I? How do people look at me? You know, these questions are being tailored towards identity, self-identity, having a sense of who you are. You know, most of the times in our interaction with people whom we feel have undermined us, well, do you know who I am? So when you tell people, do you know who I am? What do you mean? What do you mean? Hello, are we together?
Yes, we are together, sir.
So when you talk to people and you ask them who I am, do you know who I am? What do you want the person to know?
You want the person to be afraid of you.
To be afraid of you?
And portrayed a very big image of your personality.
A fake image before that person.
You are trying to put forward your own personality, isn't it? Perhaps he has not understood your personality. Every one of us carry a personality. So you are trying to make him identify who you are. So one common thing that is lacking generally in people who suffer personality disorders is the issue of identity and sense of self. Because they lack a clear or stable image of themselves, of who they are, and how they see themselves. So how they see themselves often changes depending on the situation they find themselves in. Their self-esteem may be unrealistically high, it may be unrealistically low. So there are some persons when they get to where there are rich persons, people of affluence, you know, they lost their personality. There are persons who, when they see educated people, they lost their personality. So the issue of identity and the issue of sense of self is very key and critical in identifying people who suffer personality disorders. Now, you will also notice that these people struggle to form close and stable relationships with others. And the reason is not far-fetched. They have beliefs, they have heard problematic beliefs, superstitions that they have heard so dear to their hearts. Even though they may lack empathy or respect for others, they are emotionally detached or they overtly need attention. Are we together? Hello,
yes, we are
class.
together.
Yes, we are.
Are we
Some
sure?
of us are lost.
Yes,
We're not,
Pardon?
not all. Some of us are lost, sir.
Yes, Jigba, it
You are
was
lost. Where
network
were
that
you
threw you
lost?
out.
Yes.
Okay, where were you lost?
Actually, the causes of personal the causes of personal disorders lost at that point. To be candid.
Okay. Who was following that can find him?
So you're talking of identity and sense of self.
No, who can help him
This
find
one, sir.
where he was lost under the causes of personality disorder? Okay, very quickly. We had discussed the role of genetics, brain functions or brain changes. We spoke about childhood trauma, verbal abuse, and cultural factors playing significant roles in the onset and development of personality disorders. That's, in summary, that's just what we had looked at as the causes of personality disorders. However, for genetics and brain damages, we were saying that for genetic studies are ongoing to link certain genetic traits to the onset of personality disorders, but it is believed that personality disorders are linked to specific genes. And for brain damages, we were saying that the amygdala and the frontal lobe play significant roles in the onset and development of personality disorders. We spoke about trauma, childhood trauma. When a child is exposed to trauma, he develops paranoid personality disorder and even antisocial personality disorder. We spoke about verbal abuse. We also spoke about cultural factors. Cultural factors vary from one culture to another, and they have a way of influencing the onset and development of a personality disorder. We were able to say that when you look at countries, the Asian countries, there is a low prevalence rate of antisocial personality disorder, but they have high prevalence in dependent, borderline, and histrionic personality disorders. Then we moved into where you have met us, trying to look at what signs to look at to enable us qualify or diagnose an individual to be suffering from personality disorder. I would say the first thing we look at is the issue of identity and the issue of sense of self. And we were saying that when you are angry in an outburst and you are telling someone, do you know who I am? All you are saying in that question, do you know who I am, is to try to bring out, you know, a position of your own personality. You are trying to ascribe a personality status to yourself. And we're saying that one thing that is lacking in people that suffer personality disorder is a general lack of a clear, stable image of who they are. So most often than not, you will notice that they may be bringing or they may be placing themselves in an unrealistically high self-image or unrealistically slow self-image. And the reason is not far-fetched. They are looking for an identity, a sense of self. Who am I? Providing responses or answers to the question, who am I? And secondly, we say that they have problems with relationship. They struggle to form close and stable relationship with others. The reason is that they have problematic beliefs and behaviors that they have held tenaciously to, and they don't want to dispatch. So they lack empathy. They may lack empathy for others or respect for others. You know, they can be emotionally detached or be overly. They may need attention and care. You know, while we were looking at types of personality disorders, we were saying that we have a type of personality disorder called dependent personality disorder. And for this kind of people, overly, they are emotionally attached to people who meet their own needs. And while we were discussing narcissistic personality disorder, we say they consistently want to be placed above others. So much respect, They lack empathy for others. So this type of people, they have problems with relationships. So when you see people having problems with relationship, these problems could be problems in a social, in social setting. It could be in family setting. It could be in academic or office settings. You will notice that these people that are consistently having problems with relationship have one form of personality disorder or the other. And another distinguishing sign of personality disorder is that most people who have one often have little to no insight or self-awareness of how their thoughts and behaviors are problematic. Have we ever observed people around us with this kind of attitude?
Yes, sir. Yes, sir.
Yes,
So
sir.
you are now beginning to understand that when people begin to portray this kind of attitude, the reason is not far-fetched. They are suffering from one type of personality disorder or another. So how do I know that someone has personality disorders? Their behavior is inconsistent. Their behaviors are frustrating and confusing to loved ones and other people they interact with. So it is also a form of a self-assessment that when you notice inconsistency in your behavior, and your loved ones are being frustrated and confused about who you are, know that you have a personality disorder. And they may also have problems understanding realistic and acceptable ways to treat others and behave around them. Their feeling of superiority, their strong belief to superstitions, make them have on issues understanding how to behave in a way that is generally accepted. And they may be unaware of how their behaviors is causing problems for themselves and also for others. And if they are apparent, you will notice that their parenting style may be detached from a normal parenting style. Of course, you know that in parenting style, we have the authoritarian parenting style. We have the authoritative parenting style. We have the democratic parenting style. We have the laissez-faire parenting style. So these kind of people take the extreme authoritarian parenting style. When you assess their parenting style, in case they are parents, they are over-emotional, they are abusive or irresponsible. And this can sometimes lead to physical, emotional, or mental issues on their children. So how do you know? How can you or even assess from your children if you have personality disorder? You will notice that when they hear the sound of your vehicle coming or they hear your voice outside, if they are watching television, you know all of them will run to the bedroom. They will come back, greet you, and run away from you. They are saying, Daddy, there is something, Mommy, there is something wrong with your personality life, your personality. Are we together?
Yes, sir.
For those of you who are parents, I'm not saying go and be a laissez-faire parent because we are talking about personality disorders. That's not what we are saying.
Let me contribute, sir. Let me contribute.
Okay, please do.
Yes. Some of us that are parents, when we change our mood, immediately our children see us coming and say, that is the common, that is the
Yes.
common. But when everything is so, I totally agree with you that all this affects our personality disorder. Thank you.
Yes. Let me even give a clear distinction now. It is an individual can have ups and downs on different days. Remember, when we talk about personality disorders, we are talking about consistency in a pattern, in a behavioral pattern. Not that you went to work, you had an ups, and you are coming back, and you know, you carry a different personality outlook. You know, maybe you became aggressive at home, or there was an emotional outburst, and then you are saying you have a personality disorder. That does not in any way qualifies you to be diagnosed, or any other person to be diagnosed to have suffered any form of personality disorder. Are we together?
We are together, sir.
Okay,
Yes,
how do we treat personality disorders? Most of the personality disorders are treated in psychiatry, in the psychiatric hospital, because of the symptoms that are present. Remember when we spoke about paranoid personality disorder, we say one common feature of paranoid is delusions. And delusions are positive signs of mental disorders that are very difficult to treat. So treatment is focusing on the symptoms that are being manifested consistently being manifested by the individual who suffers personality disorders. And as such, they are treated in the psychiatry. But for personality disorders, we are saying that they are the most difficult disorders to treat in psychiatric practice. So even if a person has personality disorder, he seeks treatment, modern medicine is still lacking in available treatment options. So there are no medications currently approved to treat any form of personality disorder. But there are medications that can help with symptoms of anxiety and depressions, which are common in people with personality disorders. Do we understand that?
Yeah.
I'm expecting people will ask questions with this last point I have made. And if there is none, we can make progress. Can we?
Yes, sir, let's go.
Yes,
Okay.
I think the explanation is very clear, so we can move on.
Okay. Okay. So another form of treatment is what we call psychotherapy, talk therapy, or talk cure. Yesterday, I had mentioned that when you see psycho and therapy, psycho means the mind, and therapy means treatment. And because individuals' behavior are originating from the individual's brain, the mind needs to be talked to change or to modify the way it is acting. So talk therapy can help manage personality disorders. And psychotherapy, as we have said, is a term for a variety of treatment techniques that are aimed to help you identify and change troubling emotional thoughts and troubling behaviors. Now, the individual is brought into a point of understanding that his behaviors are problematic to himself and also problematic to others. So the main goals of psychotherapy in treating personality disorders is to reduce immediate stress, such as anxiety and depression. Another goal is to help the person understand that their problems are internal and not caused by other people or situations. We call this locus control. And locus control has to do with a situation where an individual attributes the causes of his problem either to external sources or internal sources. So when an individual attributes the causes of his problems to external sources, we say he has external locus control. But when he attributes them to internal sources, he has internal locus control. So what psychotherapy does is, in personality disorders, is to help an individual develop an internal locus control. That my problems are from within me and not from outside that I have presumed. Are we together?
We are together, sir.
So there is also what psychotherapy helps to do is also help decreasing unhealthy and socially undesirable behavior. Remember, we say they have problems with social relationships. So psychotherapy also helps modify the personality traits that are causing difficulties. So certain techniques of psychotherapy can be used. Certain techniques of psychotherapy can be used, in the treatment of individuals with personality disorders. We have dialectical behavioral therapy, which is very effective for treating patients or people, patients with bipolar personality, borderline personality disorder. Why cognitive behavioral therapy is very effective for the treatment of histrionic personality disorder. Remember, I have told you that in our second semester where we are discussing psychotherapy, we'll be discussing in details these therapeutic approaches, the DBT, the CBT, the REBT. We'll be discussing them in details, their techniques, their application, and disorders that they can be applied to. Are we together?
We're together.
Yes, sir.
So is there any question?
Yes, sir. There is.
Yes.
I
Okay.
just want to...
So now.
Yes, sir. When we discuss the causes of this, most of these disorders,
Personality disorder.
Yes, sir. I try to juxtapose, especially the verbal abuse. Looking at that, and you said sometimes it gives birth to narcissistic disorder and sometimes even obsessive disorder. So my question is, given that understanding, is it possible for one to experience two or more of this disorder in an individual? Can an individual have more of this disorder?
Yes, it is possible for you to experience two or more of these disorders. For instance, it is possible for you to experience obsessive compulsive disorder and also have suffer from dependent personality disorder.
Okay.
And remember, it varies from culture to culture. Are we together? In Nigeria, it is very possible.
All right.
It's very possible.
I have one, sir.
It is possible for an individual Nigerian politician or an individual follower of a politician to have narcissistic and social personality disorder coexist presenting at the same time.
All right.
I don't know if I've answered you.
Yes,
sorry to the
very
politicians in the class. We are not picking them up for discussion. We are only making examples to help us understand these disorders.
Fine, sir.
Sir, you mentioned one treatment of personality disorder. You mentioned psychotherapy, in bracket talk therapy. So is it only by talking? Is it only talk that can be a therapy, or any other thing that can shape away your personality disorder will be accepted?
Okay. It is called talk therapy because the therapist is talking to the individual, is interfacing with the individual with the aim of helping the individual identify problematic variables within or traits within himself that are causing him distress. But when you go down to the principles of these therapies, you will notice that there are other approaches, there are other techniques that are used. For instance, when you talk about behavioral therapeutic approach. We also have techniques like dance therapy, psychodrama, and role play as techniques that are used in treating individuals with disorders. So it is broader than just talk. There are also other activity involved components of those therapies.
I can't hear anything.
Pardon?
I can't hear anything.
Can you hear me now?
So we can hear you.
No, I'm referring to that person who said he cannot hear anything.
Yes, I'm all ears. It's a different person that was answering you, sir. I'm all ears.
Yeah, he's having problem with his network at his end. That's the problem.
Okay.
No, I asked the question and I'm following you as you're answering the question.
Okay.
It's in the right direction, sir. Thank you.
Oh, okay. So, but for personality disorders, we are mentioning CBT. Now, even for CBT has a component called relaxation therapy. It has another component that has to do with token economy. Now, but they are not useful in the treatment of personality disorders. That's why we have not mentioned them. But generally, these therapeutic approaches also involve certain activities as the case may be in relation to the distress the individual is experiencing. I don't know if I've answered you.
Very convinced, sir. Very, very convinced. Thank you very much.
You're welcome. So is there any other question?
Yes, sir. I just want to get clarity on one thing that has been disturbing me.
Okay.
Sorry. If, let's say, I know of someone that anytime he has money, like he's a contractor.
Yes.
Anytime he hits a contract and makes money, everybody in the family, his wife and children are now people that he doesn't joke with. He will be so, I don't know how to put it, but he will be behaving like a lion.
Aggressive.
In the house. Aggressive with everybody. As soon as the money finishes, he will come back home. He will be a very humble husband to the wife, a humble father to the children. I want to know whether that is also, it can also be described as a form of a disorder or something.
It's a lifestyle.
Okay.
Yes, it's a lifestyle. The term personality is drawn from the Greek word persona, meaning mask worn by Greek actors, while they're on stage. When you're on stage, you wear a different personality, isn't it?
Yes, sir.
Off the stage, you wear a different personality. Now, for this man, he decides to wear a narcissistic personality outlook when he has resources. And the whole essence is to prevent to prevent accountability of the resources he has. Is that okay?
Yeah. Yes, sir.
You will see, you cannot diagnose him to be having narcissistic personality because the duration he has money may just be for 1 week or 2 weeks, or even just 1 day. Isn't it? So,
yes, sir.
The DSM classification of mental disorders look at consistency for a minimum period of 3 months and 6 months to 6 months.
Okay.
So then he wears an outlook of a narcissistic personality when resources pour in.
Yes.
Now, when resources are gone, he wears, the personality the attributes of a dependent personality, where he comes back to depend on the family, to tell them, you know, I didn't know what came upon me, this and that, you know. Are we together?
Yes, sir. Thank you.
It's all right. Any other
Excuse
question?
me, sir. Excuse me,
Yes.
sir. My hand is up.
Yes, Lucy.
This DBT is effective for treating BPD while CBT for HPD. Please, I want an explanation on that. Thank you, sir.
The dialectical behavioral therapy. DBT is an acronym for dialectical behavioral therapy. It's a therapeutic technique under the behavioral school of thought. And it is effective for treating people who have been diagnosed with borderline personality disorder. Now, can we very quickly go back to look at, to maybe look at what is borderline personality disorder for you to understand what we are saying. It is a condition that is marked by difficulty with emotional regulations, and it results in low self-esteem, mood swings, and impulsive behaviors, and the individual has problems with relationships. Are we together?
Yes, sir.
In dialectical behavioral therapy, the individual's behavior is x-rayed in a manner that he is able to see his attributes where they are causing his problems. And the cognitive behavioral therapy for people with histrionic personality disorders. So what is histrionic personality disorder? I want us to also quickly go back to histrionic personality disorder. The emotions are unstable. There is unrealistic self-image of who you are. You know, these kind of people are looking for the approval of others. They want others to approve every of their behavior before they know that what they have done is correct or not correct. Are we together? So the cognitive behavioral therapy is a therapeutic approach that is aimed at helping an individual discover faulty thought process. The thinking is not correct. How can I correct that thinking? I will develop the correct thinking for myself. So, under the cognitive behavioral therapy, a technique known as thought restructuring is used to help people with histrionic personality disorders to be able to overcome negative thought process that have placed them as people having low self-image. Lucy, have I answered you?
Thank you, sir.
You're welcome. Is there any other question?
Yes, Doc.
Okay,
Yes,
Ralph.
Good morning, Doc.
Morning.
I want to ask a question and also like a clarification. Like for those who have, how will I put it, a big heart that nothing moves them. They are not anxious, anything like, for example, this program we are doing, you have some that even when they say do this, they are not so quick to, nothing moves them. They have a kind of big heart and it's consistent with them. So is that a lifestyle or a personality disorder?
It's a lifestyle.
Okay.
It's a lifestyle. Yes.
Excuse me, sir.
Yes, Emmanuel.
Sir, if I may really ask, sir, what are the causes of this disorder and how can one prevent them, sir?
This lecture you are taking is going to help you prevent personality disorders.
Okay.
But the causes ranges from genetic predisposition, the role of genes in the onset of these disorders, brain malfunctioning,
okay,
childhood trauma, verbal abuse, and cultural issues that are peculiar to individual cultures. They can cause and trigger the onset of personality disorders. Are we together?
Okay. All right. Thank you, sir.
You're welcome. So on that note, we say Asante Asana, thanks for listening to this lecture on personality disorder. Very quickly, I want us to move into looking at sexual disorders. Sexual disorders. Are we together?
Yes, sir.
We are together.
What do we understand by sexual disorders? What's in your own way? What do you understand by sexual disorders?
Okay, let me try.
Yes, sir.
In my own way, I can say these are aberrations in the exhibition of sexual activities.
Aberrations in the exhibition of sexual activities. Okay. Any other thoughts?
Hello.
Yes, Manuel.
All right. Good morning, sir. To my own understanding, sexual disorder, it actually means any conditions at all, condition or challenge that might actually cause effects or affect an individual's sexual response, whether sexual desire, another. This, for example, now there are cases of VVF for children, because there was a time we ran a research on it. And then we got to discover that majority of VVF cases actually happens with early children. And then in the long run, it actually affects their sexual desire. And then even when these people actually get married, they don't find pleasure during sex and everything. So these are some of the challenge, and that leads to some of the cases that lead to sexual disorders.
Okay. Any other contribution? Okay. Sexual disorders as a form of disorder of psychopathology has to do with conditions that affect an individual's ability to experience or engage in sexual activities in a healthy and fulfilling way. Any condition that affects an individual in his ability to experience or engage in sexual activities in a healthy and fulfilling way. And you notice that these conditions can impact sexual desire, sexual arousal, orgasm, or overall sexual satisfaction. Are we on the same page?
Yes, sir.
Yes, sir.
So, sexual disorders are classified into two. The first form of classification is what we call sexual dysfunctions. Sexual dysfunctions. And we have the second classification as paraphilias. Sexual dysfunctions and paraphilias. So, under sexual dysfunctions, when we say something is dysfunctional, we're saying that it was functioning before, but it has started malfunctioning, isn't it?
Yes, we are with you, sir.
Yes, so sexual dysfunctions has to do with malfunctioning. Malfunctions that have arisen in an individual's sexual life. And one of the first
Sir, please unmute yourself. The noise on began. I muted everyone.
Okay, so one of the sexual dysfunctions we are going to look at is called erectile dysfunction. And you know that erectile dysfunction has to do with difficulty in achieving or maintaining an erection. We also have the second form of a sexual dysfunction known as premature ejaculation. That is ejaculation that occurs too quickly. And then the third one is what we call delayed ejaculation. Difficulty ejaculating. Then we also have female sexual arousal disorder. Female sexual arousal disorder. Difficulty becoming aroused or experiencing lubrication. The fifth sexual dysfunction we're going to also look at is called female orgasmic disorder. And this has to do with difficulty in achieving orgasm. We also have hypoactive sexual desire disorder. Now here there is low sexual desire. And the seventh we're going to look at is called sexual aversion disorder. Avoiding sexual activity due to fear, anxiety, or disgust. Are we together?
Yes, sir.
Yes, sir.
So we also going to look at a second group under the paraphilias. And the first one we're going to consider is pedophilia. And pedophilia has to do with sexual attraction to prepubescent children. You know what prepubescent children are? Before puberty. Before puberty. You know what puberty is?
Yes, sir.
So, Emma, what is puberty? Can you help us throw more light? I know Lucy is not aware of what puberty is.
Biologically.
Puberty is
okay. Talk.
Yes, Lucy, I'm listening to you.
okay. Puberty is when this anybody that has not reached the age. Puberty is that age that has reached it's okay for them to engage in sexual activity like adolescents, but a pedophile is somebody that likes having sex with small babies.
Wait, let me probe this definition of yours. So every adolescent has reached the age of having sex. Lucy, are you there?
Yes, sir.
Okay, so you say they have reached the age of having sex. So onset of puberty is for early maturers is 9 years. Are you aware?
Yes,
what?
Early maturers. And then for late maturers, you talk about 11 years. That's for females.
Yes.
For the boys, it starts at the age of 13. For early maturers.
Okay.
So at that age, are they old enough to have sex?
No.
Okay. Emma, you wanted to say something before Lucy jumped in.
Yes, sir. You asked me of the definition of what I understood by puberty. So I was going to actually, you've already said everything actually. And then to me, just to add to it is it's a stage. It's a stage. And in puberty, it varies actually, sir, from girls to boys. But the difference is not really that much. I think for ladies, then they have rapid growth. So they'll start from around nine thereabouts. Then for male, it starts around that kind from 10 years. But these days, some young is actually starts from maybe even 8. So I think maybe it's an effect of climatic change now on even the stage of puberty. So it's not really as static as it used to be.
Okay. Any other person?
I can just say maybe.
Let me add. Good morning, sir.
Good morning.
Okay.
Samuel.
Let me just add to what he said, sir. So like you rightfully asked us, puberty is a stage whereby little adolescents experience changes in their body. For the female and the male, we can start with pimples on the face. For the male, change in voices, their tones, and hairs in their most sensitive areas like the armpits and the private parts, and severe. I think for the ladies, seeing their monthly flow. So that's a little I can add to it.
Okay, thank you. Okay. Puberty is a time in life when a child experiences physical and hormonal changes that marks a transition to adulthood. Note that there are physical changes, there are also hormonal changes. And these physical and hormonal changes are pointing to the fact that the individual boy or girl has begun a journey into adulthood. Is that okay? Now, all you have, the definitions you have given are correct. So it is marked with certain characteristics. Is that okay?
Yes,
so
sir.
we, in pedophilia, we are talking about children who have not yet attained puberty. I want us to go to look at the definition of poverty to give us a clear understanding of who a pedophile is, or what someone who is suffering from pedophilia does. Are we together?
Yes, sir, we are together.
Okay. Now we have under paraphilias, we have exhibitionism as a disorder. Exhibitionism. It has to do with exposing genitals to non-consenting individuals.
These are really disorders.
Pardon?
So these are really disorders.
Yes. Then we have voyeurism. It has to do with observing non-consenting individuals in private or intimate settings. Maybe a woman is taking her bath, then you go and put your eye somewhere and you are watching her nakedness. Then we have fetishism. And fetishism has to do with sexual attraction to non-living objects or specific body parts. We also have transvestic fetishism. Transvestic fetishism. It has to do with sexual arousal from dressing in clothing typically worn by the opposite sex. I know when we begin to discuss transvestic fetishism, you will have a lot of questions to be asking about our pattern of dressing presently. Then we have what is called sexual sadism. Sexual sadism, deriving sexual pleasure from inflicting pain or humiliation. And the last one we're going to look at under paraphilia is sexual masochism, deriving sexual pleasure from receiving pain or humiliation. So sexual disorders can result from a complex interplay of physical, psychological, and social factors. Here are some of potential causes of sexual disorders. First, we have medical conditions. You know that medical conditions can also trigger sexual dysfunctions. Disease conditions such as diabetes. You know, diabetes is a health condition that has to do with either elevated or a low insulin in the body. It is a serious medical condition that can cause an individual to suffer erectile dysfunction. And most of the times, it co-occurs with cardiovascular disease and hypertension. It occurs with hypertension that progresses to cardiovascular disease. And then there are also neurological disorders that can cause sexual dysfunctions. Are we together?
Yes, sir, we are together.
Are there
Yes, sir, we are
questions?
together.
Are there questions?
Yes, I have a question. I was waiting for you to ask.
Yes.
My question is actually the first slide where you spoke about sexual disorder and you said about low cravings for sex. Let me put it that way. Let me try to paraphrase. So my question is, I from your explanation, I come to understand that the disorder is when the right things that actually need to be there to put pleasure or to give sex a partner pleasure is really not on ground. So sir, if low appetite
Sorry. Can I hear you again?
Okay, you said disorder are actually things that actually affect someone's sexual life or response now to sexual urge and other things that has to do with sex.
Anything that is not in order is a disorder.
Okay, sir. So my question is, if low cravings for sex is a disorder, then how are we to actually classify excessive appetite for sex? Because I've seen so many instances whereby some married couples are actually complaining that their husbands is actually too much in demand for sex and all that. So I don't know if you can classify
too much.
Sir?
They are complaining that their husband is demanding for sex too much.
Yes.
Okay.
So
Okay. When you say something is hyper, it means it's too much, isn't it?
Yes, sir.
When you say something
Hey, I'm not hearing again. Hello, sir.
Are we together?
Yes, sir.
Yes, sir, we are with you.
Are you with me?
We didn't hear that, sir.
The network. We didn't hear what you said last, sir.
Okay, can you hear me now?
Yes, you were trying to explain hyper.
Okay, now I say that when you say something is hyper, it means that thing is much, isn't it?
It is.
Yes, sir.
When you say something is low, it means it is not much.
Yes, sir.
But for us to be able to understand hypoactive sexual disorder as a disorder, I want to ask, what is the normal average time in a week that a man and a woman are supposed to have sex?
Like
when
3
we
days.
say it is low.
At least up to 15 times in a week.
Okay, Ralph says 15 times.
Pina said 3 times too.
Okay, Pina says 15 times.
3 times. 3
Okay,
times in
3
a
times.
And
Okay,
the
Jennifer.
one is Apple
5 times,
15 times a week.
Jennifer.
In a week.
Yeah, I think depends on the
5 times
activity.
in a week.
Hello, sir.
Yes, I'm with you.
I think it depends on the nature of the man's standing. If the man is so busy, if the man is sound health-wise and all that, it depends. It all depends. But I think maybe 4 times in a week, maybe 4 times in a week, I think it's better to keep it on the minimum.
Okay, so medically the average.
Okay.
Pardon, Jigba, you wanted to say something?
Yes, I wanted to say something.
I know Jigba.
I think it depends on the couple's arrangement. It is the atmosphere that will determine how many times or how long. Okay.
Okay, listen, we're not talking about atmosphere. Hold atmosphere constant. Hold every other thing constant. What's the average time? Number of times?
15 times. 15 times in a week.
So my hand is off, sir.
Yes.
15 times is too much. You want to kill her?
Who told
Yes,
you
I'm
it's
with
only
you.
the woman that feel it? Even the man feel it too.
It's not.
Okay.
Hello, sir.
Yes.
Medically, 3 times in a week. If you're having, you have to consider yourself. The type of food you eat. And somebody that is having more than 3 times in a week, that person is trans abuse. Thank you, sir. That is my
Okay.
Hello, sir.
Yes, Emma.
Hello, sir.
Yes, Emma. Okay. Okay, the normal average time for a man and woman
Hello,
to have
sir. You there
sex.
with me, sir?
Hello?
3 times. 3 times.
Yes. 3 times, right?
Yes.
Okay. The average number of times a couple can have sex in a week is a minimum of 6 times.
What?
Now
What?
it can go to as much as 8 times.
Calm down, ma.
It can go to as much as 10 times depending on the couple's level of arousal. Now, when all these factors are constant, so all these factors are in play, and then there is no desire. Are we together?
Yes, sir.
It becomes a disorder.
Hello, sir.
Yes, when every other factor is in place.
Hello, sir.
Yes, Ted.
I think in modern days, this time
No, I'm not
around.
talking about modern days. I'm telling you the standard, the standard medical number of times.
Sir, please let me say something.
Okay, go ahead and say something.
The financial standing of a man to keep the house, make these things available, and make the house comfortable. I think this is what prompts this arousal for both couples. So sometimes, depending on this thing, for me, that's what I think. It's not.
So when, okay.
So
I disagree with
all
you.
things are all things are equal, I
So
think.
I agree with you.
It's
So
it
you
always
said to
comes.
him,
Yes.
I disagree with that section.
Okay. When all these other factors are interplay, it can be more. That does not mean that if you are having sex 3 times a week, you are committing a crime.
Yes.
Are we together? But when the couples are staying together and there is low desire for sex from one or either of the partners, in a week, there is no desire for sex, there is maybe sex occurs just once, it's a disorder. Or you don't have for 1 week, 2 weeks, I don't want sex, so I'm not interested. It's a desire, it's a disorder.
Thank you, sir.
Thank you. Can we make progress?
Yes, sir.
Thank you, sir. Thank you, sir.
Okay, so physical causes, we have mentioned illnesses such as diabetics, cardiovascular diseases, hypertension, and neurological disorders such as stroke, can, be a cause or potential causes of sexual disorders. Apart from the physical cause, medical causes, there are also hormonal imbalances.
Yes.
Such as low testosterone in men, thyroid disorders, or hormonal fluctuations. Undersecretion or oversecretion of hormones. Then, apart from that, people who suffer depressions and are on antidepressants, blood pressure, medications, and other prescription drugs can be a physical cause of sexual dysfunction. Then we have the 4th one, substance abuse. Excessive use of alcohol, tobacco, or illicit substances can also cause sexual dysfunction. Do I have people in the house?
Yes, sir.
Yes, sir. Yes, sir. We're all here.
Yes.
Yes, sir.
I was expecting some questions
Yes.
on substance
Yes,
abuse.
sir. I want to ask a question here.
Yes.
We have made to understand by some views that sometimes when people take these substances, this especially the number 4, like alcohol, this and that, it makes them bang very well. So how does that become a dysfunction?
Okay. Alcohol only increases your sexual desire. It does not give you the capacity to, it does not give you the stamina for sexual intercourse.
Okay.
And that is why when a man takes alcohol, his vision becomes blurred. Even if it is a goat that is wearing skin, you say the goat is looking beautiful.
Seriously?
I totally agree with you, sir.
So several persons who have taken alcohol have ended up sleeping with people, with girls or men ordinarily in their lives. They wouldn't have dreamt to sleep with them in their normal state of mind.
That's it.
You are absolutely right, sir.
That's very true, Doc.
You are
So,
very, very correct.
All right.
Can we make progress?
Yes.
Yes, sir.
There are people who suffer sleep disorders. People who suffer sleep disorders. Sleep apnea, insomnia, or other sleep-related issues.
So please unmute yourself.
So if I may add. So if I may add.
Yes. I'm with you. Are we together?
Fire on, sir.
So people who suffer from sleep disorders may actually also experience sexual dysfunctions. Then we are also saying that you know that sleep disorders has to do with a disruption in the normal sleep pattern. And then we have psychological causes of sexual disorder. And the first one we're going to look at is anxiety and stress. And we talk about performance anxiety. Performance anxiety. Anxiousness about performing during sexual intercourse. There is increased societal expectations. A few days ago, about 2 or 3 days, I was on Facebook and I saw, is it an old post? I don't know whether it's an old post, but it was a picture of a man who was lying dead on the hotel bed, who wanted to satisfy a lady, performed to the satisfaction of the lady he took to the hotel, and he slumped in the act. Now, there is apprehension about sex and there is a hyping about sexual performance in our society recently. Like every young man wants to satisfy every lady. This is resulting to anxiety, and it is one cause of sexual disorder. And then we have relationship stress, and we have generalized anxiety as psychological causes of stress disorder, sexual disorders. Is there any question?
Yes, sir.
Yes.
So how can sleep become a disorder in terms of sexual disorder?
Okay. A sleep disorder first is a condition that disrupts normal sleep patterns. It leads to problems with the quality, timing, or amount of sleep, causing daytime distress and functioning impairment. Are we together?
Yes, sir.
Hello?
We're together, sir. We're
together.
A condition that disrupts your normal sleep.
We're with you, sir.
And when your normal sleep pattern is disturbed, it results to problems. Or this has to do with the quality of sleep you have, the timing of your sleep, or the amount of hours you sleep. So do you have sex in sleep?
No.
So when you are feeling so sleepy.
For how many staff?
Hello?
Sir, we're here.
We're here.
Yes. When you are feeling sleepy, you know, it becomes difficult for you to have sex. And sleep disorders has to do with your having difficulty in falling asleep or staying asleep or excessive daytime sleepiness or unusual behaviors during sleep.
Sorry, sir, unmute yourself.
Are we together?
Yes, sir. Please, I have a question,
Yes,
sir.
So
I also have a question, sir.
It affects your sexual performance. Yes.
My question has to do with I don't know whether should I call it a belief or something somebody said some time ago, that once you don't have sex 3 times in a week, after a long time, you discover that your system as a man, you begin to become, your erectile will become weak. Is that another a disorder, or, and again, is that thing tenable? Is it true?
When you don't have sex 3 times a week, is it because you don't have desire, or it is because you have pains?
Yes,
there is what?
There are times no desire, but most of
Especially
the
when
time,
you don't have
maybe
money.
you are having time with God, so you abstain for some time,
or you are
so to
financially
say.
crippled.
You see, these are actually beliefs. There is
Okay.
nowhere also in the Bible where God says when you are having time with him, you must abstain from sex. There is nowhere in the Bible. And that is why Paul writing to the brethren in Corinth, and also I think in Ephesians, he will say that unless the 2 of you agree.
Yes.
So even fasting does not stop sex. Even when you are fasting, you can have sex.
All right.
So there are a lot of superstitious beliefs that men have heard over time. That when you don't have sex over time, you become weak. No, it's not possible. Except there is either a physical cause or there is a psychological cause.
All right. Thank you so much, sir. I'm
You're
so
welcome.
happy. Thank you.
You're welcome. So we talk about depression, low mood, loss of interest, or decreased libido. They all are psychological causes of sexual disorders. We have trauma, past experiences of abuse, assault, or trauma. Young boys and young girls who were sexually abused in their early ages tend to develop sexual dysfunctions. And then we have relationship issues, communication problems, intimacy issues, or relationship conflicts. They are psychological causes of sexual dysfunction. And remember, sexual dysfunction simply means your sexual life is not functioning properly. Then we have body image issues, where you have negative self-perception of yourself, low self-esteem, or body dysmorphia. Are we together?
Yes, a question, sir.
Yes.
Sir, I want to know and I want to ask, sir, how does trauma disorder affect an individual? At what age? Because you said from early stage, there's a way sexual trauma affects individual. From what age does that actually happen, sir?
At any stage at all. Trauma can happen to an individual during childhood. Now, almost all the children that were victims of the Yellow Water attack are traumatized. And trauma manifests certain symptoms. Nightmares, anxiety, insomnia, depression sets in. We have just said that depression is also a cause of a low of a sexual dysfunction. Past experiences of abuse. A child who was abused sexually at a tender age lives with that trauma to develop hatred for men and for sex. Are we together?
Yes, sir, we are.
Yes, sir.
So, body dysmorphia has to do with a disorder where there is where an individual has perceived negative image about his own appearance. It can also result to sexual dysfunction. Are we together?
Yes, sir.
Yes, sir.
So we also have social and cultural causes of sexual dysfunction. First, we have societal expectations. Unrealistic expectations around sex, performance, or body image. Unrealistic expectations around sex, performance, or body image. Cultural or religious beliefs. Restrictive or guilt-inducing beliefs around sex. And then lack of education, limited knowledge about sex, relationships, or communications. And also we have social anxiety, fear of judgment, rejection, or social evaluation.
Green money agriculture. Okay. Also, you're value between 18 and 14 years. 18 and 14.
Are we together?
Yes, sir.
Yes, sir, we are together.
Who is making noise?
So there are also other factors like aging. You know, as you age, there are natural changes in hormonal levels. Your libido decreases. There's also decrease in physical functioning. So when you are advancing in age and you want to perform sexually like you were before, when you were young, you know, it's not possible. It's becoming, it causes dysfunction. So age causes dysfunction. And that is why you will notice people who are advanced in age begin to take sex enhancers that in the long run renders them very, very dysfunctional. They become sexual enhancing dependent, depending on these drugs for sexual activities.
Observation, sir.
Yes.
It's already time for break.
Okay. So I think we will pause here.
Right,
when we come back, we'll take lifestyle factors, and then we'll look at medications, treatment, and then we will call it a day for today. So if there are questions on what we have discussed, we will wait to take them when we come back for break.
Okay.
So have a nice time during break.
Thank you, sir.
You too.
Thank you, sir. Thank you very much.
Thank you.